This patient was referred to me about a year ago, almost a year ago, for endodontic retreatment of tooth number 28. You can see there is a crown on the tooth, prefab metal post, previous root canal, and a periapical relucency. How many of you would immediately, as soon as you see this, how many of you, raise your hands, put in the comments, how many of you would immediately recommend endodontic retreatment, non-surgical endodontic retreatment, or an apical, or non-surgical endodontic retreatment followed by an apical right away? How many of you? Raise your hands. Well, I asked the patient just questions. How long ago was this root canal done? She didn't really remember exactly, but she said a few years ago. I said, has this tooth ever hurt? Has this tooth ever bothered you? Can you chew on the tooth? Have you ever noticed the swelling around the tooth? Have you ever noticed a bubble on your gum? Pimple on your gum? A sinus tract? A fistula? Nothing. No. The answer was no to all of that. I have no pain to chewing, no pain to biting, no swelling. I've never had any issues with this tooth. I went and saw my dentist. My dentist took an x-ray of the tooth and told me my tooth was abscessed and referred me to you so you can redo the root canal. Well, I said, well, if you have symptoms, then perhaps, maybe, I would recommend redoing the root canal. But since you don't have any symptoms, give me a few minutes. Let me try to see if we can get any previous x-rays from your dentist, or perhaps maybe the dentist before that. So patient provided us with some names, and we were able to, while the patient was still sitting in the dental chair, we were able to get some radiographs. But take a look. This is what her dentist sent us. I have no use for this. What am I going to do with this? That's the tooth here. All right, so that's a bite wing. I have no use for it. So my point was, because this patient had no symptoms whatsoever associated with this tooth, I can't just assume that periapical relucency is an active infection. So I wanted to get some x-rays from the previous dentist, x-rays maybe from 2-3 years ago of the tooth, so I can compare these periapical relucencies and see if there is any change in their size, and then go from there. But unfortunately I couldn't. So I told the patient, I said, the x-rays I got from your dentist, they're useless. So because you don't have any symptoms, I would like for you to come back and see me in a year. Or sooner if you start to have any issues with this tooth, any symptoms with this tooth. Otherwise, come back and see me in 1 year. In 1 year, we'll take some radiographs and compare those radiographs to the radiographs from a year ago when I saw you, meaning this radiograph. And then if there are any changes, if this periapical relucency has gotten larger in 1 year, which it should if this is an active infection, then we can talk about perhaps redoing the root canal. And patient agreed. Well, that 1 year was today. So this x-ray is from 2/13/2023, and today is 1/18/2024. So almost a year ago when we took this x-ray. All right, so take a look. Take a look at the x-ray from today. This is the x-ray from today. Patient still doesn't have any symptoms. Zero. No symptoms associated with this tooth. And that's the x-ray from today. Again, that periapical relucency is still there. Now, let me put the x-ray from a year ago next to this x-ray, and we both can take a look at this periapical relucency to see if it's gotten any larger. Again, it should have gotten larger if this indeed is an active infection. All right, so these two x-rays next to each other. X-ray from a year ago, x-ray from today. Do you see any changes? Do you see any changes in the size of this periapical relucency? I don't. And again, patient has no symptoms whatsoever. So x-ray from a year ago, x-ray from today. no changes in the size of the periapical lucency, which means very likely this is just scar tissue and it's not an active infection. So if I had recommended immediately a year ago recommended endodontic retreatment, I would have done treatment when treatment was not needed, was not necessary. And my fellow followers, clinicians, my fellow friends, this is how you go about properly diagnosing a problem, a tooth. Again, x-ray from a year ago, and this is the date. A year ago, x-ray from today. 118. And again, no changes in the size of the periapical lucency, and also, of course, patient has no symptoms whatsoever. Tooth percussed within normal limit, palpated within normal limits, probing's all within normal limits, 1 to 2 millimeters, 1 to 3 millimeters all around. All right, so no need to redo this root canal.